How President Obama has navigated the healthcare debate this week. We turn to our senior White House correspondent, Jake Tapper. He's in Washington sitting in for George Stephanopoulos, hosting This Week this morning. Good morning, Jake.
Good morning, Kate.
So 3 town hall meetings, and you have to say none of them were really full of fireworks. They were sort of calm in comparison to what we're seeing in the rest of the country at House members' town hall meetings. So how does the White House feel about how those town halls went?
Well, they feel like they went very well, as Rachel just said. They feel like it's more representative of the kind of debates going on throughout the country. There are, of course, accusations from some circles, conservative circles, that there is screening going on, although we should also point out that people tend to become a little bit more polite in the presence of the President of the United States. The President also is making a point of saying in all of these town hall meetings that what people see on TV and cable TV is not representative. So they're pushing back on the idea that those town halls that are such ruckus affairs are representative.
President Obama has an op-ed in the New York Times this morning, Jake, as you know, and he writes, in the coming weeks, the cynics and the naysayers will continue to exploit fear and concerns for political gain. But for all the scare tactics out there, what's truly scary, truly risky is the prospect of doing nothing. Is that the best argument he has right now? If we don't do this, we're all in trouble?
It's one of the arguments that they have. Another one that they've been citing more frequently in the last couple of weeks is talking about the insurance reforms that they want to put in place, such as preventing insurance companies from being able to deny you coverage based on a pre-existing condition. They realize that most Americans have health insurance. 200 million Americans have private health insurance, and most of them are satisfied with it. So they want to talk about how those people will benefit. But certainly right now, they're in defensive mode and trying to get the upper hand back.
Right, and bottom line it for us, Jake, because, as you say, defensive mode, even some on the left now are starting to say that healthcare reform may not happen.
Well, you hear people such as even former President Bill Clinton and others saying that what's important right now is for people on the left not to expect too much in health care reform, to be able to settle for half a loaf. And I think that that's one of the things they're doing, is they're setting the stage for not a sweeping health care reform package, but something a little bit more modest and perhaps conservative, something more like what the Senate is working on right now, rather than the more ambitious and liberal plan in the House of Representatives.